Howdy, my name is Michael Wynn. I'm one of your critical care paramedics. Today we are presenting you a video on nicardipine or Cardene. We are doing this because in certain instances, Cardene infusions will become ALS within the system for IFTs. We'll go through the details of that a little bit later in the video. To start off with, Cardene is a calcium channel blocker and antihypertensive. The primary advantage of this drug is that it selectively dilates the peripheral arteries, reducing peripheral vascular resistance, which in turn lowers blood pressure. Another advantage of Cardene is that it has a rapid onset and a shorter duration of action, allowing it to be turned on or off quickly. Cardene is used for the management of blood pressure in ischemic and hemorrhagic strokes. You may also see it used for hypertensive emergencies such as aortic dissection, non-STEMIs, STEMIs, and hypertensive encephalopathy. Hypertension and increased MAP will exacerbate ICP and neurologic injury, which is why this drug is used in these patients. As noted before, ALS units will start transporting patients who are only on Cardene drips for blood pressure control. We are not, however, starting to carry this drug. The critical care group will continue to handle Cardene drips for patients on multiple vasoactive infusions, art lines, and other things that qualify them for an SCT. Cardene is a very common infusion for patients we transfer out of our community hospitals to larger and more specialized downtown hospitals. Many of these cases are time-sensitive conditions, so allowing ALS to handle these allows patients to be transported more efficiently. Two contraindications for Cardene are, of course, hypersensitivity to the drug and cases of severe aortic stenosis. Cardene can reduce afterload and diastolic pressure, which can worsen cardiac outputs in severe stenosis, so please note your patient's past medical history. Per protocol, the dosing of this drug is to be started at 5 milligrams per hour if not already initiated by the sending facility. Titrate this in increments of 2.5 milligrams per hour every 10 to 15 minutes to meet blood pressure parameters. The max on the drug is 15 milligrams per hour. The most important thing to understand about blood pressure parameters for Cardene is that they are set by the sending physician. This overrides the parameters in our protocol and supersedes them. It's very important that you obtain sending physician blood pressure parameters when running one of these transfers. The sending nurse will almost always know what the parameters are. If they do not, find the sending physician. This is important because doses may vary based on what condition is being treated and often are also directed by specialists off-site such as neurologists and neurosurgeons. We have some basic dosing guidelines for the protocol, but you must adhere to the blood pressure parameters set by the sending physician. If they don't give you any, you have to find them and don't be passive about this. Dosing ranges for our protocol. In ischemic strokes, you must consider if the patient received thrombolytics, aka TPA or alteplase. If they did, titrate the Cardene to a systolic blood pressure lower than or equal to 180 and a diastolic lower than or equal to 105. If the patient did not receive TPA, let the blood pressure run higher and only treat the BP if it is at or above a systolic of 220 or a diastolic of 120. The reason for the difference in parameters is for patients receiving thrombolytics, the blood pressure needs to be tighter controlled to help protect from converting their ischemic stroke into a hemorrhagic stroke. If the patient does not receive thrombolytics, we allow permissive hypertensive, unless it is severe, to maintain perfusion to the already ischemic brain. In hemorrhagic strokes, we're more aggressive with blood pressure control in these patients to minimize bleeding and the volume of the hemorrhage. In these patients, titrate to equal to or lower than systolic of 150 or a MAP lower than or equal to 100. Please note that we're trying to stay just below these parameters. More is not necessarily better, and we are not looking to normalize these patients' pressures necessarily. For non-stroke cases, if you do not receive titration parameters, contact OLPG as they may be variable. Cardene will come with multiple presentations and there are multiple concentrations on the market that you will see at different sending facilities. The most common concentration you will find is 25 milligrams in 250 ml or 0.1 milligram per ml. And this is the concentration that is programmed into the Sapphire pumps, which is now on the field level as well. However, you may see other concentrations such as 20 milligrams per 200 ml and 40 milligrams per 250 ml, which is 0.2 milligrams per ml. It is very important to verify the concentration of the drug while setting up the drip in the guardrails on the Sapphire pump. If it does not match what is in the guardrails, there's a way around that we'll get to in a second. Also, when titrating Cardene, do not forget to treat pain. If you try and lower a patient's pressure with Cardene before addressing their pain and then later address their pain, you can find yourself with a pretty substantial drop in MAP, which can be detrimental to the patient. Now, when setting up the pump, always verify the concentration in the guardrails on the Sapphire pump. If these do not match, you can use general settings for different concentrations and enter in your own concentration and dose rate. Do not use the ml per hour option in general settings, as that will make titration much more difficult. Save yourself the trouble, don't do the math, use the dose concentration. We'll go through that here in a second. As always, after you're done setting up your pump, verify the ml per hour rate on your Sapphire and make sure that it matches the sending facility ml per hour rate, just to verify your dose. Thanks for watching and everything you do for our system. We'll have a little bit of addendum to the end of this video where we go through setting up the pump on a dose concentration rate in general settings. Again, keep up the good work and we'll see you out there. If you have any questions about Cardene, feel free to reach out to me or any other critical care providers that you see in the field. Okay. So let's say that you are ready on your IFT to switch over the Cardene onto your Sapphire pump. Turn on the pump, of course. If you'll notice, this one is in the field configuration. Cardene is already in the guardrails for the field pumps. Select New Infusion, Find, and you'll find it under N for nicardipine, not C for Cardene. Find, and there you have it, Cardene. Select Cardene. It has one concentration programmed into the pump. That's the 25 and 250. If the sending facility has that concentration, congratulations, you're in luck. You just hit 25 and 250, select your dose rate. The starting rate is 5. And then your volume to be infused will be the 250 that your bag is. Done. It'll even tell you how much time you have for an infusion to transport. Now, if you don't have 25 milligrams in 250, you can go back. Now, you can choose general settings, but do not choose ml per hour. If you do this, then if you have to titrate your drip, you'll have to do all the math all over again every time you have to titrate. Make it easy on yourself, use the dose calculation. By doing dose calculation, you can pick however many units in whatever solute you have, so milligrams and ml. Say they gave you the 40 in 250. Verify the concentration there. It is not weight-based. And then your dose rate will be milligram per hour. And then you just press 5. This way, when you need to titrate your drug, you can simply hit dose rate, change it from 5 to 7.5, so on, however you need to do it, without having to calculate the actual flow rate per hour. And then just unclamp it and hit start. And that's how you use the dose calculation in general settings. Again, please do not use ml per hour. Thanks.